Well, hello everyone. It is 7 o'clock, actually 7:01. There's a bit of delay with the my words and what you're hearing, but I'd like to start on time. So welcome to the webinar called Everything You Need to Know About Your Hormones. And my name is Dr. Nathalie Beauchamp, and some of you may not know who I am. I am a wellness chiropractor in Orleans, the outskirts of Ottawa. I own a clinic called Santé Chiropractic and Wellness Center. And I'm just passionate about health and wellness in general. I'm currently doing my functional medicine course with the Institute of Functional Medicine, which has been a great journey, I must say, and I'm learning tons. And this is the information that I've acquired throughout the years of being in practice and so forth. And why am I talking about hormones? Well, I've been in practice for 20 years now. And I hear a lot of symptoms and complaints from my patients. So I wanted to learn more to see what I can do to help them with their lifestyle to be able to deal with changes. So my goal for you guys today is to really help you understand your body and the symptoms that it's experiencing. So it might be a bit complex, but I'm trying to simplify as best as possible. And my goal, as I said, is for you by the end of this webinar to be able to understand a bit more your hormones and what you can do to feel better. A lot of us are blaming things on age, and I always say that it doesn't have to be this way. I think once we have a good understanding of what's going on, there's a lot that we can do. And before I start a little bit deeper, I know a lot of you have registered for the webinar tonight. And for the people that could not attend, we will be sending the replay of the webinar. So welcome to the people that are here live, and welcome to the people that will be listening to this webinar and watching this webinar further down the road. So with no further ado, let's get started. So the first thing we have here, well, let's define hormones. Oftentimes, even preparing for this webinar, I would say to people, I'm doing a webinar on hormones, and most people think of our sex hormones. So we're thinking of estrogen and progesterone, but there's a lot more to it. There's a lot of hormones being fabricated by the body to work properly, and we're going to focus specifically on some tonight, the adrenal glands. We're going to focus on the thyroid and so forth. So let's start with the basic, what are hormones built on, and it is cholesterol. So I don't know if you knew that steroid hormones all derive from cholesterol, and we're this crazy society these days trying to lower cholesterol, and yeah, you don't want to have a cholesterol that is number that is too high and the wrong types and so forth, but we need cholesterol. It serves as a raw material to build our hormones. So cholesterol is not all that bad. And actually 25% of the cholesterol in the body is found in the brain. So pretty darn important. And, our cells are the membrane is made with cholesterol. So very important to have this building block in the body. And I mean, we could do a whole lecture on cholesterol itself, but that's not the point here. So let's start with the first thing we're going to look at, which are your adrenal glands. And some people are probably familiar with cortisol or adrenaline. We're going to focus on that, a little bit deeper as the first segment. But, a lot of people will have heard these words in the past, but these hormones are secreted by your adrenal glands, which sit right on top of your kidneys. They also produce DHEA, androstenedione, testosterone, estrogen, and progesterone to a certain level, in a lower amount for sure, but they do produce some. And we have our thyroid gland, which is located just in front of our throat, and we're going to expand on that as well. But basically, our thyroid gland secretes T3 and T4 hormones, calcitonin as well. And from the pituitary gland, which is located in our brain, will secrete the TSH, which is a hormone that's often measured, and we're going to talk about that as well. We're also going to talk about the ovaries, which are producing estrogen, progesterone, and testosterone, but they also have T3 receptors, so they are important for thyroid function as well. And we cannot forget our liver, which is basically our body's processing plant, where chemicals are broken down that we consume. So the liver's job basically is to distinguish between the nutrients you need to absorb, like vitamins and mineral, and the dangerous and unnecessary substances like drugs and alcohol and toxins that we're bombarded with, which we're going to talk about. So let's start with the adrenal health. So I put this picture here, and you can see, obviously, these people are on a roller coaster ride, and you can see that the woman bottom left is having a great time, and the other people are basically not having a good time whatsoever. So it's funny how for someone something is fun. It's all a matter of perception, and that's like that with stress overall, is how the body handle stress is going to be our perception of things as well. The next slide, I talked about cortisol a little bit earlier. I know it's very detailed, and I'm just going to go over it very quickly, but you can see on the left and at the bottom, it says short-term stress response. So when a message is sent from the brain, the hypothalamus more specifically, nerve impulse is sent to our spinal cord, and then boom, it goes to the adrenal medulla. And then we have this short stress response. So increased heart rate, increased blood pressure, sugar going to us to deliver fuel, dilation of the bronchiole. So everything to be able to respond to an acute stress. Then on the right side, we have the long-term stress response. And those are secreted by the anterior pituitary gland, and will go to the cortex of the adrenals, so the outside of the adrenals. And we're going to be secreting mineralocorticoids and glucocorticoids. All of that, again, more from the long-term response. So we're breaking down protein and fats. There could be suppression of the immune system. So all of those are okay to happen, but if we constantly have that on a long-term basis, you can see how it can be a problem. And I love this slide here, is that the bottom line, we can't be living our lives in a state of constant stress. So we're no longer chased by saber-toothed tiger, but a lot of us have this constant lower but consistent stress. That could be our job, our family. So in acute stressor, you're going to get out of there and boom, it's done. But now of these days, if we're not careful, it's that low consistent stress, which the body can't keep up with after a while. The next slide, again, very complex. And again, I'm just showing this to show you actually how complex hormones are. It is pretty amazing. The network of hormones that all connect together. So the first one, as I mentioned, top left, is cholesterol. Then we have progesterone, which we'll talk about, DHEA, testosterone, which I'm sure you've heard of, and then we have the estrogen. So you can see how all of those are connected. But what I really wanted to show you guys here is the cortisol. And I put it in red because there is such a thing called cortisol steal. So you can see that if the adrenal glands are overstimulated, it's going to increase the amount of cortisol, and all the building blocks, if you want, to produce testosterone and estrogen further down to the right, they're not going to be available. So people can really, really disturb their sex hormones if their cortisol and adrenal glands are on overdrive. So that's why, like I said, it's not that simple when we have symptoms. We have to look at everything together. So what are adrenal stressors? Well, there's a full list here, from infection to sugar to emotional stress to negative attitude and belief, nutrient poor food, toxin, smoking. So all these things will put stress on our adrenals. And if we have that constant stress, it will definitely be an issue. So what are the symptoms of adrenal? So these are main symptom when our adrenals are not working optimally, and I'm going to go into the different phases, but basically I'm going to read those out and you can see if you recognize yourself here. So excessive perspiration from, not doing too much, dark circle under the eyes, often craving for salts, waking up during the night, and very oftentimes between 2 and 4, because this is typical of the cortisol raising in the middle of the night, and I'll explain that. Chronic infection, low blood sugar, low blood pressure, muscle twitches, lack of libido, lightheadedness or dizziness, poor concentration. These are the basic symptoms. So you can see, and I'm going to talk about that down the road too, some of the symptoms can be seen in other things. And I think that's where people get really confused, because, they're like, is it my adrenals? Is it my thyroid? Is it my sex hormone? Like, what's going on? And it is confusing because a lot of the symptoms cross over, and that's what I'm trying to help you with tonight. So this is a chart of our levels of cortisol that should be normal. So if we look at the cortisol, our stress hormone in the morning, it should be at its highest. And the reason it's high in the morning is because we're awakened. We should be energized and ready to go. So the cortisol is high. As the day progresses, it lowers at lunchtime, lowers in the afternoon, and at night when we're ready to go to bed, the cortisol should be low. So this is a typical proper chart that should happen. But it doesn't always happen like this. So the first phase of adrenal stress is the alarm. And what happened, I put the chart here, and if you compare to the good one, you can see that the morning cortisol is way, way, way high. So the person can start really experiencing some of the adrenal symptoms that we talked about. Then we go to the phase 2, which is called the resistant phase. And this one is split into the early stage. And on this one, you can see that the morning cortisol at 7 to 9 a.m. is quite high. But now we're starting to see a lower level of cortisol around lunchtime and so forth. And it's also measuring another hormone called DHEA, and you can also see that the ratio of DHEA and cortisol is also out of balance. But I'm not going to get too much in the details of that. Then we have the late stage of resistance, and you can see now the cortisol is quite lower in the morning. So this person would be quite sluggish waking up in the morning, probably wouldn't want to get up in the morning, and probably feels really tired. And the third phase is the extreme fatigue. And you can see with this that the cortisol level is like flat line almost. There's almost no change, no fluctuation. So people that are that depressed into the HPA axis, will have, oftentimes depression symptom, seasonal affective disorder, fibromyalgia, panic attack, and so forth. And it can be in great, one of the great cause can be their level of their adrenals. So it's usually, obviously doesn't happen overnight to become in a stage 3. And that's why it's so important to recognize those symptoms. And I don't think general medicine focuses too much on that. Oftentimes, the doctors will say, well, you're stressed, you need to lower your stress. And they're completely right. But seeing something like this, I think, would really help people understand where they are with their adrenals. Because like I said, that cortisol still is real. And if our adrenals are on overdrive, it's going to affect all the other hormones in the body and put us out of balance. So it's very, very important. Let's talk also about the nervous system and the adrenals, because we're talking about stress, and stress, is nervousness. It's the nervous system. So why is the nervous system so important? Well, there's this great MRI picture here that you can see the brain and then the spinal cord that's in blue. And basically, that's how it works. The brain sends signals through the spinal cord, sending signal to every cell, tissue, and organ in the body. And that's how things are communicated. The nervous system is divided in two. We have on the right what's called the sympathetic nervous system, and on the left, the parasympathetic nervous system. So the sympathetic nervous system is what we call the fight or flight. So if you look at what it does, it's again that tiger that's running after you. What do you need? All right, I need the heart to go, the lungs to be able to breathe in some air. I want, blood flow to the muscle and so forth. It's not time to digest or anything like that. And on the other side, on the left, we have the parasympathetic nervous system, which is also called rest and digest. So all of that will favor rest and repair and growth, regeneration of the body. And what happens is that we need to be in balance between that sympathetic nervous system and that parasympathetic nervous system. And I cannot tell you how often, and I'll talk about that in a second, that people are what we call sympathetic dominant. So we really have to address what we call this sympathetic overload. I mean, yeah, we will have stressors and we will have a period of arousal, but we need to be able to settle back down. And oftentimes people are not able to settle back down. In our office, we have this great tool called the heart rate variability, which measures our body's adaptation to our life stressors. So this is an example of someone that's right in the bullseye, which means, is adapting to her or his stressors very good. There's balance between sympathetic and parasympathetic. And I just uploaded an explanation, and you see those three happy people that want to be in the green, which is where the heart rate variability is balanced. And if we look at the top left, we say uptight, bottom left, distress, bottom right, weaken, and then top right, exhausted. And I must say that thankfully I don't see too many people in the exhausted phase, in the sense that by the time this technology measures it, the person probably wouldn't even be in the office. But we do have this technology, and it is such an eye-opener for people to sit back and look, whoa, I'm completely in sympathetic overdrive. And after a while, the body just can't keep up. So a great way to measure our level of stress and its effect on our body. This brings me to this slide here, which is your spine. And love this analogy here, because I always give the example or the analogy that the nervous system is like electricity. So there's electricity coming from your brain to the rest of your body. And as chiropractor, we've got this amazing ability to detect misalignment in the spine that usually give people pain, but pain is actually letting us know that there's an issue. But we're able, by correcting those subluxation, to reset and the nervous system to its full potential. And I always give the analogy of the fuse panel. If you plug too many things, there's one that's going to trip. And it's a great analogy because oftentimes, again, if we're bombarded by too much stress, our spine is going to trip. And I always say the nerves don't go just one way. They don't go just to from your brain to your body. It goes both ways. So if we eat the wrong things, if we're stressed out, if we don't exercise, if we're bombarded with chemicals, all these things can really trip our panel. And this is where chiropractic care can really help rebalance that parasympathetic system and sympathetic system, and help support all the organs and the adrenals included. So how do we balance that nervous system? Well, the first one, is get adjusted. I cannot tell you the results that we see with adjustment on that HRV test of people that had a score that was, 30 or 40 out of 100 to suddenly increasing in the green zone and having, decent adaptation. Getting enough sleep is also very important. We cannot cut on sleep. This is where our files in our brain, just like a computer, will, get reorganized and so forth, growth hormone and all of the things that we need to recuperate. Important to exercise, but don't over-exercise. And I see that often, especially with athletes. They're already tired. And if you're in stage 2 or 3 of adrenal fatigue, you're just not going to make, progress, and you're going to make yourself worse. So sometimes exercise is not, or intense exercise is not appropriate when your adrenals are tapped out. And when I say that to athletes sometimes with the results and the tech machine that we also have at the clinic, they're not happy, but you can't keep going and have no fuel in the tank. At some point, everything is going to be affected. Meditation, breathing work, obviously eating a good diet. We'll talk about that as well. Massage, acupuncture, tapping technique, reflexology, yoga, whatever you like to use from a more holistic point of view or relaxation point of view will be helpful. Obviously, supplements and nutraceutical, which we'll talk about, and botanical and adaptogen as well. So let's talk about those. I compiled, we're going to talk about vitamins and herbs as well, but I compiled a list here of good vitamins to support your adrenals. And by golly, I much rather people get their vitamins and nutrients from whole food. So that's my little disclaimer here. I prefer whole food, but the reality is oftentimes we're not able to get the proper nutrients that we need. So a good quality multiple vitamin, but with special attention to the B complex. So we're looking at B5, B6, biotin, and folate. Vitamin C, 1 to 2 grams. Magnesium, at least 400 to 600 milligrams. Omega-3, 1 to 3 grams of EPA, DHA. Zinc is also very important, and you'll see that also with the thyroid gland, 25 to 50 milligrams, because more than 300 human enzymes utilize zinc, so it's huge. And vitamin D, and people ask me, how much vitamin D should I take? I don't know. Best way to go is to get tested, and then if you know your levels, then you'll know what exactly you need. So my next slide here is exactly that, is a test result of optimal levels of vitamin D. And you can see this person sits at 138, which is fabulous because they are in the optimal range. So when people get tested and they're in the mild to moderate deficiency, well, you're going to need more than 1 international unit to rebalance. So it's easy to find online chart to tell you how much you should up your vitamin D level and get tested again in 4 to 6 weeks. Always best to get tested after the winter because you're most depleted at that time, and then you can, supplement with the vitamin D that you need. Again, is it better to get it from the sun? Yes, of course, but depending where you live, it's not going to be realistic for you to get the sun. I'm in Ottawa, and winters are long, and I know that I don't get enough sun. So get tested. It's easy to get the 4-point cortisol levels tested. And one of the really easy way to do it is with saliva. So you do it in the morning, at noon, around dinner time, and before you go to bed. I'm going to talk about different tests that are available, and there's a new one that's really, really interesting. It's been out for a few years now, but I just came across it recently, and I'm really impressed. So I'll talk about that down the road. But why saliva versus blood when it comes to hormones? Well, they say that the hormones that are actually enters the tissues are what's measured, because the hormone pass through the saliva glands tissue before they get into the saliva. So it's compared to blood, which measures what potentially can go to the tissue. So having a full blood panel by your family physician and having something like this, especially for the cortisol, because that's definitely something that is not measured. Now, I talked about all those phases, and I mean, I could have gotten into detail because each phase could have different botanical to help, but I'm not going to go crazy in the details. But one of the supplements that I really like, it's called Adrenal Smart by Lorna Vanderhaag. And basically it contains, again, botanical that are what's called adaptogen. So she's got Radiola rosa extract, Suma root, Schisandra berry extract, and ashwagandha root and leaf extract. So all of this to help balance your cortisol level. So they're not hormones, they're just botanical to help decrease your cortisol low enough that you'll be able to get to sleep properly and you won't wake up in the middle of the night at 2 or 3 in the morning like you're ready to take on your day. Oftentimes, women do not need to be on this all the time, depending again on how their lifestyle and their stress are in their life. So a lot of people, if they're going through a rough time, not sleeping properly and so forth, they know their adrenals are taxed. It's a good way to help them. Next, let's move on to the thyroid gland. And as I mentioned, the thyroid gland is that little butterfly gland that we have in front of our throat. And this is one of the slides that I actually took from the Institute of Functional Medicine, just because it summed everything so well. So I'm just going to go through it. So you can see that the thyroid will secrete T4, which then is converted into T3, which is the active form, and also reverse T3. So what are the factors that can be impeding on the production of the thyroid hormone? Well, stress is one, infection, trauma, radiation, fluoride, because it's an antagonist to iodine. So a lot of city water is full of fluoride. So if you think you have thyroid issues, something to look into. Toxins, pesticides, mercury, cadmium, lead, autoimmune diseases like celiac can have an effect as well. And then other things that will increase the conversion of T4 to reverse T3. And as you can think, it's not a good thing. Trauma, inflammation, toxin, infection, some medication as well. So what are the supplements, or the vitamins, I should say, that are supportive? So iodine is obviously the main one, but there's also tyrosine, zinc again, selenium, vitamin E, B2, B3, B6, C, and D. And then the oftentimes women will make enough T4, but it's not converted well into the T3, the active form. And again, selenium and zinc are crucial for that. And then moving down the chart, the factors that improve cellular sensitivity to the thyroid hormone: vitamin A, the zinc again, and exercise. So there's a lot that we can do with our lifestyle, as you can see, by including the proper foods versus, and also taking some lifestyle stressors out of our life so we can function better. So what are the symptoms of being hypo? Hypo means your thyroid is not working properly. It's sluggish. So fatigue, weight gain, feeling cold, dry hair and skin, hair loss, menstrual irregularities, edema, muscle aches and joint pain, constipation, and depression. These are the typical symptoms of hypothyroidism. I mean, it doesn't mean you'll have all of them, but these are the symptoms that are most common. What are the symptoms of hyperthyroidism? People are nervous, irritable, increased heart rate, may even have palpitation, heat intolerance, increased sweating, tremor. On the opposite with these people, they'll lose weight, and even if they're eating, they'll go to the bathroom often. And we might even see enlargement of the thyroid gland, which can lead to what is called goiter. And we'll talk about that in a second. Now, laboratory workup, there's quite a bit that can be measured. Most often in the regular blood test, in the province that I'm in anyway, TSH is the one that's measured. And if your TSH is within normal, they say your thyroid is normal. Well, as I said, doing my course in the United States, it just opened my eyes to all the tests that are routinely done over there versus over here, because oftentimes women will go to get blood test and they'll say everything's fine, yet they're feeling like crap. So they're thinking, well, what's going on here? So there's a lot more that can be tested. Obviously, the T3, the T4, the reverse T3, the total T3, and then you can measure some ratio to see where is your thyroid not working properly. And the other big one too are the thyroid antibodies as well. But as you could see, hormones are all interlinked. So if there's one that's not working properly, well, it will affect, a lot of different things, and it will throw things out of sync, and will have some repercussion. These were over here some of the numbers that you should have. So if any of you on the webinar wants these numbers to compare, I'd be more than happy to share them with you, or I guess you could also do a screenshot. Other blood tests that can be done: iron, which is routinely done, zinc, selenium, vitamin D, iodine itself, and we'll talk about that in a second, celiac panel, IgG for food sensitivity, and also toxic minerals. So, to me, when somebody's being told that, there's no issues with whichever, and we're just measuring one thing, yes, it could be the most important thing, but there's, we got to look at the entire person and see what's not, what they're missing. For people that have hypothyroidism, having a diet that's a little bit higher in iodine can be very valuable. People that are hyper have to be very careful, actually. So something to take in consideration. But if you don't know where you stand, it's not great. Toxins. There's at least 150 industrial chemicals that have been shown to result in the reduction of TSH and T4. So we're looking at all the toxins that were bombarded, the PCBs, the biphosphate, the BPA, the phthalate, the dioxin, the organochlorine pesticide. So all of this, the stuff that, we're more aware of now, but that we still are bombarded with if we're not being careful. So that's, the message I'm trying to give here is that there's a lot that we can do looking at our lifestyle to balance everything in our body, so we're not feeling bad and we're not feeling sick. So little slide here, fluoride, is it safe? Here a slide that I got from an educational site on the side effects, and as you can see on the right side, it can impact the thyroid, but among other things, a lot of different things can happen. So thyroid support, let's focus on nutrition that will support our thyroid need, like we talked about, the selenium, the zinc, eliminating the toxin and the medication that affects the thyroid, and looking at infections maybe that are not taken care of, and inflammatory condition. I will most likely do my next webinar on the gut and having a healthy gut to decrease inflammation. A lot of conditions now are inflammatory condition, like diabetes and heart disease and so forth, because our bodies are in a chronic inflammatory state. So sleep and exercise and all of that stuff, all the stuff that we know is important, and you've heard it, but here are, the why they are so important. Here I put a quick compilation of some of the supplements. So iron, especially for menstruating women, zinc, selenium, vitamin D, again, get tested, and iodine as well. And if you can get from your food, even better. What else could change the absorption? So interesting here, calcium carbonate, soy, coffee. So again, if you're drinking 7 or 8 coffees a day, you may want to revisit that. Antacids and ferrous sulfate, and possibly grapefruit juice that can have an impact. So again, things to take in consideration if you think you have some thyroid issues. This here is a urinary thyroid test, and as I mentioned, I'll go a bit more in detail, but you can see here ways to measure the T3 and the T4. That's just from urine. You can do much more detail with a full blood panel, but this is definitely a good place to start if you don't want to go the blood route. And then there's the urinary iodine test, which measures iodine, obviously, but also bromine, because the polybrominated diphenyl ether is basically flame retardant, which we know we're surrounded with, unfortunately, and they've been shown to be related with neurotoxicity, thyroid dysfunction, and will disturb the calcium homeostasis, and also measures cadmium as well, which is also potentially a neurotoxin, and so forth. So there's a lot of tests that can be done to get a clearer picture of what's going on. Why is the thyroid not working properly? What can we do to support that thyroid? Supplement-wise, again, there's a lot of supplements on the market. Lorna's thyroid supplement is one that I often recommend. She's got L-tyrosine in there, ashwagandha, guggul extract, pantothenic acid, some iodide, copper, and manganese. And she obviously suggests taking it with a good multivitamin, which is going to be high in selenium and zinc. And this is not a hormone. It just helps for your T4 to be converted into T3 more efficiently. So people can have a better functioning thyroid hormone. All right, I'm just going to take a glass of water here. So let's move on. Now that we've done the adrenals and then the thyroid gland, let's move on to our sex hormone. Lovely picture of the ovaries here. Love this picture. So when we think hormones, this is, I think, what people will think about it. A grumpy old lady that's just, not happy. And I put this picture actually on the poster for the webinar, because if you feel like this sometime, we have a problem and we need to talk. So going back here to my lovely chart here, if you remember, so we're starting with cholesterol, just to, again, just to show you how complex this is. But this is how your progesterone, your DHEA, your testosterone, and your estrogens are fabricated. And that's why, it's such a complex thing. Some of you may be familiar with this. Most women will know that at day 14, they ovulate. And the only reason why I put this slide here is just to show people that estrogen level will be high in the first 14 days in the follicular phase, but then progesterone will be higher in the luteal phase. So when we measure hormones, let's say with a regular blood test, and we don't even know where the woman was in the cycle, you can't really, have a good picture of what's going on. And that's why hormones are, the estrogen, progesterone, DHEA are so complex to be able to monitor and figure out. It's actually shocking how, we don't have necessarily good measuring system, because depending where the woman is in the cycle, it's going to change tremendously, and we can see what is going on. So that's why if you think you have issues, we definitely have to dig deeper. So let's take the first one and let's talk about estrogen. So what is the role of estrogen? So it promotes the formation of our female secondary sex characteristic, accelerate metabolism, reduces muscle mass, which is not great, the reverse of testosterone really, increase fat stores, lipogenic, stimulate endometrial growth, uterine growth, vaginal lubrication, thickening of the vaginal wall, bone formation, promote heart health. So you can see that this hormone is for women, meaning that we were designed to bear children and have a bit more fat and less muscle mass. So we would be able to, if we go back to our survival days, to be able to reproduce and do it efficiently. So that's what estrogen is. And not to go again in a lot of details, but we have 3 types of estrogen. Estrone, which is E1, estradiol, which is E2, and estradiol, which is E2, and estriol, which is E3. And basically, again, I don't want to go in too much detail, but estrone is the main estrogen produced by women postmenopausal, and it's also unfortunately implicated negatively in breast and uterine cancer. Estradiol is the strongest estrogen, and it really helps in concentration and bone density, growth, cognitive function, cardiovascular, mood, and so forth. So deficiency can really impact things like osteoporosis, heart disease, dementia, and things like that. And estriol is the weakest of the 3, and is there to protect breast and vaginal tissue. So all those hormones can be measured, and we can see where they are and if we are in balance. But again, it's complex. And if you get a blood test and they don't ask you where you are in your cycle, it's hard to know if you have more estrogen than you should or less, because that blood test now becomes a snapshot in time. And if you don't know what you're looking at, it can be confusing. So excess estrogen, which I always tell patients, we unfortunately are bombarded by estrogen. It's in the water that we drink, it's in the plastic, it's leaching out everywhere. And we see it affecting our men and even our young boys, that you'll see some with, developing breast and so forth. So it really is a big issue, and it's called estrogen dominance. And we'll talk about that in a few minutes. But what are the symptoms? We're looking at uterine fibroid, fibrocystic breast, ovarian cysts, endometriosis, and even cancer when it comes to estrogen dominance. But we're looking at depression, decreased sex drive, PMS, hot flashes, weight gain, insomnia, irritability, all the stuff that is not going to make you feel good. And also all the stuff that I'll talk about that after, but some of those could feel like symptoms of menopause. And oftentimes I get people say, geez, am I starting menopause? And maybe you're not starting menopause, but if your estrogen is way out of balance with your progesterone, you might have some issue. Low estrogen, the symptoms: brain fog, painful intercourse, recurrent UTI infection, dryness, vaginal dryness, thinning of the vaginal wall, hot flashes and night sweat as well, and infertility. So obviously not good to have it too low as well. So what can affect those estrogen level? And I mean, there's a huge list here of things that we're always bombarded with. So pesticide, herbicide, and fungicide. And that's one of the good reasons why it's helpful to eat organic, not to have that. Hair dye. A lot of women don't think twice, get their hair dyed. Nail polish is another big one. Don't think twice of what's in there, and let's put it on there. Paraben, phthalate found in soap and cosmetic. When I give live presentation, I do this little exercise where I have a woman come up to the stage and we go over our morning routine. And the average amount of products used by a woman will be 12 and above. And people will say, oh, no, I don't put that much. Well, once you calculate your shampoo, your conditioner, your soap, like the list goes on, by the time we get out of the house, we're already toxic. So, we don't even think about that, but it's a big burden on our liver. And we saw earlier how our liver needs to be functioning properly to bring the nutrients that we need. So if it's too busy detoxifying things that we're throwing at it, it's not going to work optimally. All the plastic, the BPA, the phthalate, be careful not to microwave and use glass as much as you can. Farm fish, the pill, my goodness. So many women are on the pill for, 10, 15, 20 years. It really has a huge effect on disturbing the estrogen balance. Hormone replacement therapy, commercially raised meat and dairy. Coffee can also raise estradiol, and so is alcohol. So for women, you'll read some study that red wine is good and all of that stuff. And not to say that they're not true, but alcohol affects women in a very different way than it does for men. So again, not fun to not be able to drink your red glass of wine if you enjoy it, but if you're having some hormonal issue, it could be something to definitely look into. And then lastly, soy products. I'm not a big fan of soy product, I'll be honest, especially the non-fermented ones and the ones that are not organic, because I think it's as high as 85% of soy crops are genetically modified, and non-fermented soy has a whole slew of things that it can trigger in the body. So not a big fan of those. So tips to regulate our estrogen: balance your adrenal and cortisol, and go back to the adrenal gland, our first segment. Avoiding and reversing estrogen dominance, all the stuff I just talked about. Interval training can be very good. Sleep, limit caffeine, avoid hormone therapy or birth control pills if you can, and supplements and herb. And talking about that, again, one of Lorna's products, other companies have products, but Lorna is really, really focused on helping women and finding solution for women. So, I do like other products for different things, but I really feel that Lorna really put all her knowledge into developing those great products. So she's got Adrenal Smart, which has D-glucarate, Endol-3 carbinol, decaffeinated green tea extract, curcumin, D-indole methane, rosemary extract, and sulforaphane. And then the plus has the Vitex and the zinc, and Vitex is also known as chasterberry. So for people that have, issues with menstrual cycle, PMS, acne, even infertility, Lorna will tell you herself how many, letters she's gotten from women that were not able to conceive and have gotten pregnant, balancing their hormones. Let's move on to progesterone. The role of progesterone is basically our happy hormone, our feel-good hormone. It's important in the cycle, and the second part of the menstrual cycle, allows pregnancy to occur, affects bone formation, heart health, brain health, and as I said, our feel-good hormone. High progesterone symptoms: drowsiness, acne, mood swing, depression, weight gain, hot flash, vaginal and urinary tract infection, lower libido, headache, and incontinence. So as you can see, again, whoa, those symptoms look like the other symptoms that we talked about. And that's why it's so important to know what is out of balance. Low progesterone, menstruation will stop, loss of libido, mood swing, osteoporosis, night sweat, breast tenderness, craving carbs, and the list goes on, with, water retention, lower body temperature, and so forth. So there's always consequences. The body really wants to be in what we call a homeostasis, which is a state of balance. Progesterone and replacement therapy. If people do decide to go that route, we have to watch for insulin level, because progesterone given continuously before menopause increase insulin resistance, and at least in high doses, and then it can lead to being pre-diabetic, leptin resistance, and insulin resistance, and all of that stuff. So postmenopausal progesterone has been shown to increase the risk of breast cancer in some women, but decrease the risk of endometrial cancer. So it's just such a complex thing that you really want to get a good handle and understand your hormone. So I think, you need to know your numbers. You need to know what's going on. The third hormone, which is testosterone. Yes, ladies, we do have testosterone. The role of the testosterone is basically, well, mostly secreted by the testes in our male counterpart, but the role is to help maintain muscle mass and bone, improve sense of well-being, and sex drive. So you'll see that the symptoms of low testosterone is not feeling good, low sex drive, depression, and mood swing and anxiety and so forth. And high level of testosterone, there's a lot here and I'm not going to read them all, but it's increased muscle mass, it's well-being, it's increased sex drive and so forth. But in women, having too high of a level of testosterone can lead to some issues. Some of the ones that we see often are polycystic ovaries as well, having issues with thyroid as well, and the adrenals and so forth. So for women, we do need to have some testosterone, but to a certain extent. So let's talk briefly about menopause. I just feel like I'm throwing symptoms at you guys, and and I am, but if anything you get out of this today is that a lot of symptoms cross over, and it's important that you understand. So what are the sign and symptom of menopause? I think most people do know. You have this aunt that is almost in her underwear and red in the face because she's so hot and uncomfortable because she's still having some hot flashes and so forth. So being fatigued, irritable, cranky, not sleeping well, hot flashes, loss of libido, gaining weight, can even have palpitations. So all of these can be symptoms. So what to look for in menopause, and I go back to our adrenal gland here and our adrenaline, is that if a woman is entering menopause and her adrenals are fatigued, her adrenal gland, which are supposed to kick in when our ovaries decrease the production of estrogen and progesterone, well, if they're tapped out, it's not going to happen. And on top of that, if the woman is in high adrenaline state, it's not going to be good. Low blood sugar, estrogen dominance, adrenal stress, and not to forget too, dysbiosis, which is so important to have a healthy gut. 80% of our happy hormone serotonin is produced in the gut. Our immune system is mainly in the gut. So if the gut is not balanced, again, a lot of food is not going to be absorbed. The nutrients are not going to be absorbed properly. So we really have to make sure that the gut is in good shape. Suggestion for hot flashes, again, taking control of that adrenaline, sleep, avoiding sugar, caffeine, and alcohol, obviously limit temperature fluctuation. Sometimes people get some benefit with soy through food, but again, you got to be careful that it's fermented and it's not genetically modified and so forth. You got to be very careful with that. Bioidentical hormones, I'm not going to get into too much details with that. It's definitely not my specialty, but I know that's a question that I get often. What are bioidentical hormone? Well, they're called bioidentical because they use hormone that are identical on a molecular level with the hormone used in the replacement therapy, but we have to be careful. They're not natural. They're still synthetically formed, but they're synthesized from plant chemical extracted from yam and soy. So are they safe? Again, you got to do your research. You got to do your reading. You got to see where you're at in the continuum of needing hormone. You got to look at your lifestyle and see if there are things that you can change in your lifestyle before you get to that point. One of Lorna's product, again, Smart, which is great to reduce hot flashes, night sweat, and irritability. And she's got black cohosh in there, donquay, chasteberry, gamma, oryzonol, and asperidine, all things to help with hot flashes. So I told you earlier that a lot of the symptoms look the same, and I love this chart because it does show how menopause, adrenal issues, thyroid, and even liver that's not working optimally can give you symptoms. So, you have to go get tested, and you can't just have your blood results and say everything's fine if you're not feeling fine, if you're not feeling yourself. And I think as women, as we age, we often go with, oh, my body's changing. Yes, the body changes. A woman in their 30s, 40s, 50s, 60s, 70s is not going to be the same, but you should always be able to have control, and you should be feeling good. If you're not, there's a lot that can be done. So I talked earlier about serum testing, saliva testing, and talk about urine testing. So I'm going to spend the last few minutes on this because I think it can be very enlightening for people to realize that there are other, methods of testing. So if we start with the serum testing, this is probably the most accepted one. It's reliable, it's not too expensive, but again, the adrenal hormone cannot be effectively tested with that because free cortisol cannot easily be tested at multiple points throughout the day, so that's a big flaw. And only a few metabolites are tested in the serum. Saliva testing, great for measuring the free cortisol. Not always easy to spit in that little tube, but again, it's better at figuring out what reaches the tissue, but it also has its limitation because the free cortisol and metabolized cortisol cannot always be measured as well. And same thing with sex hormone. Metabolites sometimes are giving you a more precise picture. And then urine, again, a little bit inconvenient to pee in a bottle for 4 times a day, but it can give you some results. But there are also some limitation when it comes to urine testing. So the test that I was referring to earlier is called a Dutch test, and everything basically that we covered tonight can be measured with this test, and it measures the free cortisol pattern, melatonin, which I didn't talk about, but melatonin has basically the opposite curve of cortisol because you're either awake or you're asleep. So your melatonin should be low in the morning and high at night, for obvious reasons, so you can get to sleep. Androgen metabolites, basic hormone, estrogen metabolites, and cortisol metabolites are what's measured with this test. And what's great with this test, it is urine, but it's you're basically just peeing on some strips 4 times a day, put it in a bag, and it's sent to the lab. So it's called a Dutch test. There's a lot of information online if you want more information. I know that myself, I've started to use it. This is just a snapshot of the top of the report, but it goes quite a bit in detail. And once your healthcare provider can interpret this report efficiently, it's amazing the amount of information that you can get from it. It's not cheap. Obviously, there is a cost to it, but well worth test if you ask me, to see your estrogen, progesterone, testosterone, DHEA, cortisol. And it doesn't specifically measure the thyroid gland, but with some of the results, you can, kind of extrapolate how efficient it's working as well. Oof. So what is a gal's gut? what does a gal have to do to, to decipher all this? Well, I think the main points that I want to finish on is, first, we got to take charge. We can't wait on somebody else. And I know sometimes people will say, well, geez, I don't have a medical degree. This is not my field. You don't have a choice. You need to educate yourself if you're not feeling right, and take charge, ask questions. Second is you need to listen to your body. Again, I cannot reiterate enough that we should not feel bad. And if you're feeling tired and sluggish, doesn't matter your age, there's something that can probably be done. Get the right test. If you get your blood tested with the basic stuff and they say nothing's coming up, ask, dig, go see, a different, more of a natural healthcare provider. Naturopaths can order blood tests, full panels really easily, and they're very knowledgeable at reviewing all that. And then implementing some lifestyle changes. I talked about, a lot of stuff tonight that I think you can start incorporating in your life, that it is decreasing the toxins that we talked about, or your diet, and then supplementing with proper vitamins, herb, or adaptogen that would be helpful. Don't forget, I put this slide here again from the Institute of Functional Medicine, something I have access to, but it's eating by colors, to have what diversity in the colors, or phytonutrient-rich fruits and vegetables. So we literally need to eat the color of the rainbow if we do want to get all the nutrients we need. And sometime too, another thing that I have access to is the elimination diet, is that sometime you just got to roll up your sleeve and eliminate things from your diet for a while, so you can reduce your inflammation, repair your gut, reduce the toxic burden, and identify food triggers. Because if you don't have that set, you're going to run around in circle, because all of those things are important when it comes to hormone. All right, so I put this website here. This is something that hopefully you can go and do the test. The test is basically 100 questions that I program with to have you give you results when you answer those 100 questions. I worked very hard on programming this questionnaire with balanced score to help you decipher, is it your adrenal? Is it your thyroid? Is it more your hormone? Is your liver sluggish, and so forth? It's by no means meant to diagnose anything, but I just, like I said, in the last few years, had so many people that were frustrated or discouraged, not knowing what system or what organ in their body was not, working up to par. So that survey should really, it's not a survey, it's a questionnaire, it takes about 10 minutes. You'll get the results sent to you, and the explanation of, if it's your adrenals, if it's your digestion, if it's neurostructural, it's all explained. So hopefully that questionnaire will help you kind of zero in on the areas in your life that need areas in your life in terms of lifestyle, but what in your body is not working properly. So that brings me to the end here, and I have a few questions that have been asked, so I'm gonna take two because I don't want to go too long. I wanted to go under an hour. So the question was going back to soy, actually. So yes, I mentioned that I'm not a big fan of soy, and the research is mixed on certain things when it comes to the impact of soy and on hormone. But if you are going to eat some soy, make sure that it's fermented. So, and it is not soya milk, it is not tofu. The fermented are tempeh, natto, and miso that are fermented. And again, make sure that you try the genetically, the ones that are not genetically modified. So buying organic is also really important. The other question that I had was, can I take a multiple supplements? And the answer is yes. Again, whole food is the best. There's no ifs or buts about that. But if you do need to supplements, depending on which one, you definitely can take the ones that I mentioned. Would I take them all at once? Probably not. You got to zero in on what is more important. But as I talked about with the complicated chart there, you got to look at your adrenals. You got to look at your thyroid. You got to go step by step to make sure that each of those are working properly. And if your symptoms are crisscrossing, that you know exactly what it's about. So I hope this was informative to you guys, and I encourage you to go do the 100 question do the questionnaire to help you decipher and narrow down, and never stop looking for answers for you. Health is definitely a journey, and we can always get better within our own lifestyle. And I always say you can't change habits overnight, but if you change things one thing at a time, even if you change one habit a month, at the end of 1 year, you will have integrated 12 different new habits into your life. So that can be life-changing for most of us. So, you know, just start, okay, where do I start? I'm going to start, you know, buying products that are not as toxic. I'm going to start you know, going to bed earlier to get my 8 hours of sleep. These are things that are kind of cliche to a certain extent, but they are basic. So I hope you had a great presentation and that you enjoyed the presentation. And thank you for taking the time to work on yourself and making sure that you're staying healthy. Thank you very much.